Pandemic continues to spread across the world. I want to take you now to what is known as the epicenter of this, and that is China. We're speaking to the UNAIDS country director for China. That's Ama Kobe-Sande. She's a Kenyan living and working in China. Ama, thank you so much for speaking to us. Just describe for us what it's been like living in China, the epicenter of this pandemic.
Thank you, Yvonne. Nice to be here. I live in Beijing. I've been living here for close to 3 years. Essentially, Beijing emptied out. This is a city of 22 million people, and it became a ghost town. Where were people? They were behind their walls in their houses. There was nothing happening, no movement on the street. All we did have was essential services. So supermarkets were open, pharmacies were open, and what was very clearly visible was a network of community overseers. In some places, they call them community guards, sitting outside residential buildings, residential compounds, and monitoring movement in and out of those compounds. But essentially, it was a dead, quiet ghost town.
Tell me, Ama, you've traveled from China to London and back to China, both countries heavily affected, and we're being told to self-quarantine. How does, in fact, Ama, you are in self-quarantine as we speak. How does self-quarantine work in China?
14 of self-quarantine, so I've completed it successfully. I'm expecting to go to work tomorrow. Self-quarantine here happens within a very clearly stipulated regulatory framework together with a community system. So before I left London, I had to tell my residence management that I was coming to Beijing. I had to say on what day, what flight, and approximately what time I would be arriving at my house. That was before I left London. Once I arrived in the country, there was a very clear system for disembarking the flight. It took us 3 hours to get off the flight because screening was being done in relation to what countries people were coming from. I arrived at my residence and they would not let me in. The residential caretakers or overseers asked me to sign 2 documents. The first document had to do with the Beijing municipality regulations. So I had to sign that I agree to abide by Beijing municipality regulations. And I'll say what those are in a few minutes. And then the second document that I had to sign was a travel history form. This is at my residence, basically saying where I had come from again and what my travel history was. Now, the Beijing municipality regulation I had to sign basically committed me to staying in my residence and never leaving. Secondly, I had to take my temperature 2 times a day and submit that to the residence administration. In fact, one day I was caught up in a meeting online and I was 1 hour late. They came to my door to get the temperature reading. So you have to submit temperature readings twice a day. Tomorrow, I go back to work, and what's expected to happen is my resident administrator, where I live, has to clear me. Then I will apply for an exit pass to leave my home. And thirdly, I also need to sign that I will abide by the regulations that now will happen at my place of work. So temperature check every day when I enter the building, not more than 4 people in the lift, and then continuing social distancing at work. So as you can hear, it's not something you do on your own. The notion that self-quarantine is completely left to the individual for self-monitoring and self-management just does not exist here, Yvonne.
Okay, my final question, China seems to be getting through the worst of it. In fact, we're hearing now that Wuhan has now had 24 hours of 0 new infections reported. Of course, there's still much work to do. What advice, we know you're not a doctor, we understand that, but what advice, what lessons can Kenya learn from China? We can't build a 1,000-bed hospital in 10 days. We don't have the resources that China does. But what are some of the lessons for you, for your country, from China where you live and work now?
It's been very clear in China that it's been a whole of society approach, a whole of government and a whole of society approach, and both coming together united really to confront a war, and they are determined to win. So on the part of government, really, it's about citizens having confidence that the government is really going all out and leaving nothing to chance. The Chinese government went all out. And even though the measures seemed extreme at a certain level, it assured us and made us feel safe. On the part of the citizens, it's also about people coming together and saying, how do we work with our government to fight this war together? And there are a lot of things that may not necessarily involve money, but other things do. There are simple things like coming up with a social contract. Have you had a discussion amongst family members to agree how you're going to manage this issue? Are the younger people committing to protecting the older, more vulnerable one? Has any conversation happened in your residential community compound about the social contract you will have together to protect one another and look out for one another? And then in terms of the social structures, they may not be similar to China. China has a completely different system, but we do have our own social structures. You have your WhatsApp group administrator who can govern the kind of conversation that you have in that space. You have your chamas. Kenyans belong to a chama, one chama or the other. Can a conversation start there about how you protect each other? Within the neighborhood watches, religious associations, again, Yvonne, it's a whole of society approach. Finally, I think I would say, watch against stigma and discrimination. It doesn't make sense when you're fighting a war to be turning in on each other. Just because someone shook someone's hand and unfortunately got infected is no reason to vilify and alienate or maim people in our own society. We need to pull together as a nation, Kenyans under one flag, to say we will defeat this thing. It has to be that way. It is that serious. We can't afford to play around or to minimize things. But let me also say that while there are principled measures that people need to take, you've heard the messaging around washing hands, not touching your face, and all the rest of it. But that messaging needs to be contextualized, because there will be people, even with the best will in the world, who will not be able to do these things or cooperate fully, because it will happen at great cost. It will affect livelihoods. So what does government say for those contextual issues in terms of the support that can be provided? And also in terms of locations, rural areas, urban, them to join in this nationwide support like has happened here. Vulnerable groups, let's pay attention to them. Let's contextualize the messages, the precautions for them using the reality of their situations.
Absolutely. Thank you very much for that great advice. And, we wish you well as you get back to work tomorrow. And Amma, thank you for speaking with us. We know it's 3 a.m. in Beijing, China, and we certainly thank you for your time. Get some sleep and wish you all the best as you get back to work. First thing in the morning for you in Beijing. Amma Sunday speaking to us live from Beijing, China. She's the UNAIDS country director for that country.